Why are doctors, residents in particular, so adverse to using the title doctor outside of work? I never go by doctor outside of the hospital is such a weird badge of honor people wear. To me, it comes off way more pretentious to be on this weird high horse of not telling people you're a doctor than to just use the title where appropriate. Doctor is a completely appropriate formal title, just the same as Mr., Mrs., Miss, and can be appropriately used anywhere any of those titles are used. Why is this community ashamed of being doctors and feel the need to hide it? I think this first reply really hits it on the nail. Ortho here. I doubt anyone is ashamed of the title, but as soon as you start announcing yourself as doctor in other settings, you invite two things. One, this a-hole is the guy who wants everyone to know they're a doctor. Or two, oh cool, I bet they can answer this question for me. Neither of those are worth my time. Hence, if I'm not in my physician role, I'm first name. Yeah, I think you'll see many, many times that physicians want to hide the fact that they're a physician when they're out in public because it invites certain judgments about you, either in a good way or a bad way. You still don't want people to change their judgment of you just because now they know your profession. I feel like I'd rather you interact with me as a human being and as an equal, as opposed to, for example, we're interacting, just normal, friendly conversation, and then all of a sudden you find out that I'm a doctor, and now you start acting differently around me or around other people. I think that's a big fear that people have. You also invite being a target 100%. Yes, and I totally agree with that as well. If people think you're a doctor, they also think you have a ton of money, and then you could be a target for any various kinds of things. My boyfriend refuses to tell strangers he's a doctor in any setting because he thinks they'll overcharge us or expect more tip, etc. This person says, it's honestly fine for people to recognize you as a physician outside the world of the hospital, but honestly, I don't announce my job to people I've just met, nor do I like my correspondence addressed to as doctor. Same thing with airlines, I don't label myself as a physician on my ticket registration. As an example, I was burned one time when out at the pub and my brother introduced me as a doctor, and a friend of a friend of a friend talked me up for a solid hour asking medical and insurance advice, and I'm like, dude, I'm just trying to not think about work right now. I don't mind helping people like family or close friends, but for F's sake, I am not going to talk 30 minutes on your medical problems after only meeting you for 5 minutes. I am an attorney who just visits the sub for the drama, and it always surprises me how many, random people from other fields happen upon this r/residency subreddit, and there's quite a few of them. But the guy in the bar scenario is 1,000% accurate for our field as well. Nothing ruins a good fishing trip like someone finding out I'm an attorney and wanting to ask the most inane legal questions the entire trip. But hey, since you're an attorney and all, if someone slips on the sidewalk in front of my house, can they sue me, or is that the city's fault since the city technically owns the sidewalk? The kids I play video games with online figured out I'm an MD somehow, but I don't introduce myself as such because I don't want to talk about work outside of work. Some people hear doctor and think free advice. I just think it's really cute that this guy has his gamer kids friends and that he hangs out with. And I kind of miss that because I used to have that as well. And now that I haven't been gaming as much, I don't have that solid gaming friend group. I have no problem using it outside of work if it's relevant or if someone asks what I do. But here are some things that I consider. Like, one, I don't want to hear about people's medical problems in public or give them medical advice unless it's urgent. Two, I don't want to hear people's opinions about doctors, the healthcare system, or whatever alternative medicine and supplements they're into. And three, I don't want someone at a business to charge me more money or try to sell me unnecessary stuff because they think I'm loaded. If I need to give a formal title for something, I do use doctor since it is in fact my title, LOL. So I think this whole topic sprung about because there was a Reddit post earlier in the week that was talking about, hey, if I'm going to somebody's wedding, should I be putting our names down as Mr. and Mrs. or Doctor and Doctor? This person kind of addresses that here. They said, a wedding, while generally formal, is closer to a social situation than an official form in most people's minds. Plus, you lose the alliteration in Mr. and Mrs. I think most people have experienced a pompous ass introducing themselves as Dr. So-and-so in a social situation where everyone else is going by Steve. Whether Dr. So-and-so is a medical doctor or has a PhD in history, they inevitably prove themselves to be thoroughly insufferable throughout the entire interaction at every opportunity. No one wants to risk being that guy. And so, yeah, I think there is definitely a negative connotation to being the one who insists on introducing themselves as Dr. X, Y, and Z. And I think in terms of people having a wedding, if you are the couple getting married, it is totally appropriate to choose whatever you want. And even if you're a guest, choose whatever you want. If you like Mr. and Mrs. or you like Doctor, whatever you want. For me specifically, it wasn't a big problem because I was a medical student when I got married. So, it was by default Mr. and Mrs. But I feel like even if we had gotten married after graduation from medical school and dental school, I probably still would have chosen Mr. and Mrs. just because it does sound, rolls off the tongue a little bit more smoothly. But I'm curious to hear what you guys think. If you guys are going to a wedding and you guys are about to get married or something, would you choose the doctor title or would you choose a more conventional title instead? Probably the biggest reason is that you mark yourself. The general public has no distinction and nuance for residents versus PCPs versus wealthy subspecialists. They will automatically assume you make big money. Not just that, but also they will assume because you spend so much time studying medicine, you have zero financial common sense and can be easily swindled. I had a used car salesman as a coworker once before med school. He mentioned that doctors were more likely to pay sticker price, take the higher interest loans that car dealerships partner with banks for, and be conned into buying the extra protection plans. It's a social construct anyway that is only relevant in the hospital or academic setting. If people ask me what I do, I say I work at the hospital. If they probe further, I'll say I'm a physician. I don't want to be bothered by somebody who wants to curbside me about their mom. I also don't want to make people think I'm flexing on them. And to be clear, I am proud to be a physician. It's my favorite job ever, but I don't feel a need to make other people feel proud of me too. I totally agree with the part with, when people ask me what I do, I say, oh, I work in health, the health field, or I work in the hospital, just being very, very vague about it. And then even when people probe further, sometimes I kind of shy away from saying I'm a physician. But I think at that point, if somebody probes you a second time, you probably should just say I'm a physician because they're asking more. But usually people, if you just say you work at the hospital, they kind of leave it at that. And I do prefer when it's like that instead of them knowing I'm a physician. And I do really like this last point that it says it's nothing about being ashamed about being a physician. It's all about just the image that you're portraying to other people and not wanting to assume any of the negative parts of that image that, people might have associated with you, or even the positive ones that you don't want them to associate with you. You just want them to treat you as, who you are in that moment. And so I like that point that they included that they are proud to be a physician. And I agree, all of us should be proud to be physicians, but we don't need to be flexing it on other people all the time and just, announcing it blatantly to the world. Hey, I'm doctor this and doctor that. The real question is, why are residents not introducing themselves as doctor to patients? It annoys me to no end when other residents introduce themselves as their first name to patients. The only time I use my first name to a patient is if they are doctor, nurse, or someone I know. I totally agree with this. I feel like in our, professional roles, we should still be very clearly announcing ourselves as doctor to the patients because it's very helpful for them to know who they're actually dealing with because there's so many people in the hospital, they literally have no idea who is even seeing them and who is talking to them. So we should be very clear about what our role is to the patient. And I know a lot of people, especially guys who are trying to be more friendly with people or try and develop some more rapport with people, will just say, hey, I'm Nick or I'm, Bob or whatever, and, try and make it a little bit more casual. And I think it's okay if you personally have that preference. I think that's okay. But I do think that it really sucks because female colleagues, and I've discussed this in a previous video, but your female colleagues do not have that same privilege of just being able to go around and introducing themselves by their first name because immediately a female physician is taken way less seriously than a male physician, both by, all the hospital staff, but also by patients. And so they very, very clearly need to state what their role is to the patient. And so in my eyes, it's better if all of us just introduce ourselves as doctor to the patients just for continuity, to make it make sense for them and to establish our roles clearly. And also to not, take advantage of the fact that there are still some gender biases with patients and their doctors and, thinking that every female physician is the nurse and such. Anyways, that was just a little bit of an interesting discussion on whether or not you should use doctor and the title doctor outside of the hospital. Very curious to hear what you guys think in terms of would you use it for your wedding? I'm very curious to hear if you guys have any other additional thoughts. Thanks again for watching, and I'll see you in the next video. Peace.